Good afternoon, everybody. It's a pleasure for us to start this hangout session with you, which is the last one before the end of this MOOC session. I'm here today with Estelle, with Elise and Xiang. You know them very much since they have participate in the discussion forum since the beginning. You know that it's a particular day for us, particular period of time for us in Belgium since the terrorist attack 2 days ago. It's a difficult situation, especially for us in Belgium and especially in Brussels, because it happened a few kilometers from here, and we know the places where those attacks happened. So let's start with questions. It's a hangout session for you. Please, if you have any question to ask, write it and we will see it right away and answer it. But while starting with the first questions, I just wanted to tell you a few words about the different homeworks you had during those last weeks. There was first a homework about asthma attack, where you could find that the answer could have been different between women and men. And you have probably seen that women answering this question had a theoretical asthma attack, while the man did not have an attack, and it was a good way to understand the importance of sex on the values for the peak expiratory flow. There was also an exercise for you on breathing like an emphysema patient, and during this kind of breathing where you have to exhale longer than normal, what you will experiment after a few seconds, when it's the decreased level of your CO2, because you exhale more CO2 than usual, and your body does not like, your brain does not like this, and your brain will ask you to take a deep inhale to find a balance between this low level of CO2 to become normal again. That's exactly something you have probably experimented. There was also a test on apnea, stopping breathing, and of course it was a theoretical exercise, and you could more or less calculate your oxygen consumption, knowing which amount of time you could stay without any breathing. But in the reality, it's quite different. When you stop breathing, of course, your level of oxygen will decrease in your body, but you have this level depends on the oxygen inside your lungs, but also on all the level of oxygen inside your body. And it will last longer than 1 minute before all the oxygen stock you have becomes too low to start breathing again. Thank you, all of you, for your answers in the forum about one pollutant of your choice, because it was a real way to have a social learning, the way everybody answers something which can help the others to understand better a particular pollutant. Thank you for that. And it's now time to start for a first question, maybe?
Yes, we have our first questions to start, and it's: how different is peripheral blood gas taken from your finger capillary than the one from your artery? Which test is clinically more reliable and why?
Usually when we have to measure the oxygen level in your blood, we will use the best way is using an arterial blood gas, like in the video, in the radial artery. That's the, but it's painful.
Yes.
And we won't do it if it's not necessary in children or in young people, because it's really painful. Then you can choose to perform a venous blood test. For instance, here, like for a venous puncture blood test. Yes, but in this case, you won't have any good information about oxygen. Then you could do a finger capillary test, but we never do that for oxygen. It's not reliable. It's good for other, for lactate or pH or something like that, but not for oxygen. The answer is that if you really want to have a good measurement of the oxygen in your blood, it's in the artery that you have to do.
And we can do that in the femoral artery?
Yes, usually we prefer the radial, and if it does not succeed, because for the artery is too small, difficult to find, painful for the patient, in this case we can choose the femoral artery. That's right.
Okay, thank you.
There was a complicated question 18.11. There was a mistake with the answer, but it's been corrected now. But I know a few people asked we discuss it now because it wasn't very clear. So you know what question I'm talking about?
It was a question, it was a difficult topic about it's about diving. It's the video and the autonomy of your bottle, the diving bottle, and the volumes of this bottle and the volumes of your lungs. And that's not so easy to understand that. When you dive to 10 meters depth, your lung volumes will decrease because of the pressure around you. Okay, this 6 liters of volume will become 3 liters. Okay, that's quite possible to understand. But if we speak about the volume of the bottle now, not of your lungs, but of the diving bottle, when you dive at 10 meters depth, the pressure is higher, and the bottle will deliver you a volume which is higher than the volume at surface. And if you breathe 1 liter tidal volume at the surface, the bottle will give you 2 liters at 10 meters depth to balance the pressure and the volumes. That was the difficulty of this question, to imagine that at depth, the volumes of your lungs will decrease, but the volume which is delivered by the bottle will increase. Both are speaking about volumes, but one is decreasing and the other is increasing. That was a difficulty.
Here I have a question from CyberChew. He's asking about the oxygen in the treatment for patients. He's asking about is the fraction of 100% always respected, and how do you consider various concentration for various pathologies?
Yes, that's true that the only way to deliver pure 100% oxygen to the patient needs the patient to be connected to an artificial ventilator with a circuit which allow there is no leakage, no leak, but otherwise, just with a mask, it's impossible to get 100% oxygen. Now, if you want to give oxygen to your patient and you don't know how much oxygen you will give, 1 liter per minute, 15 liters per minute, you don't know what to do, that's true that every 1 liter oxygen you give with a bottle of pure oxygen will allow your oxygen fraction in the air to increase by 3%, which means now we are all of us inhaling 21% of oxygen. If I give you extra oxygen with 1 liter per minute, it will increase to from 21 to 24%. But now, how much oxygen do you have to give to your patient when he needs oxygen? You have to check it with the pulse oximeter. Thank you. And if because you see the number very quickly, and if this number, which was very low at the beginning because you are ill, becomes higher than 90%, you are quite happy.
Okay, thank you.
I have another question. How does altitude affect the VO2 max? And does VO2 max become lower in altitude?
Yes.
It's very difficult, maybe?
Yes, you combine the difficulty of being in altitude with the difficulty of performing sport or exercise. And if you do that, you always see that your performance will be much lower in altitude than what you are used to do at sea level. And of course, your oxygen consumption, maximal oxygen consumption, your VO2 max, will be lower in altitude because you have less oxygen at your disposal, and so your performance will be lower and your VO2 max will be lower. Yes.
Okay, thank you.
I have a question personally. It's about effort and physical exercises. How does oxygenation affect anyone who's doing sports, and the lactic acid production? Does it have a link when we're producing lactic acid, or is oxygenation always sufficient when doing sports?
That's a very, very important topic, because the message we wanted to explain to everybody was the following. Please make the difference between a patient who will be ill with a respiratory problem. This patient has not enough oxygen because he's ill, he has a pneumonia or I don't know what. And in this case, this lower level of oxygen in his body makes his cells to produce lactate because there is not enough oxygen. Okay, but when you play sport, you are in good health. It's completely different. You never have any problem with the oxygen. But you produce lactate as well, but for another reason. It's not because you have not enough oxygen. Certainly not. You have always enough oxygen when you perform a sport. But it's just the fact that your metabolism is increasing much more. And from carbohydrates, sugars, and oxygen, the system is working faster, faster, and faster. And this system produces an amount of lactate, okay? But it has nothing to do with a lack of oxygen. That was important to explain that, and I had the feeling in the forum discussion that this concept was understood by most of the followers, I think.
Thank you.
For patients with COPD, we saw that they had chronic bronchitis and emphysema, but can these two diseases be separate?
Yes, the common point is COPD, and you have two ways. And some people may have a mix of chronic bronchitis and emphysema, and some people will be more on the part emphysema, and another. Just it can be separated. It's not the same. We have seen that it was two different videos showing that emphysema happens at the level of the alveoli instead of chronic bronchitis, which happens at a total other part in the small bronchi. Those two diseases may be totally separated in the patient, or might be of mixing. When a smoker may have, because of the cigarette, may have two diseases together, and but it's possible to have separated symptoms.
It's a remark. On the forum, some people use the volume of 250 millimeters per liter at the place of the value of 1 liter to calculate their apnea. Could you explain this again, maybe?
What would be the misunderstanding for people? I mean, your oxygen consumption would be 250 milliliters per minute.
When you breathe, but not when you're in apnea. It's the confusion.
Yes, and I'm a little bit embarrassed because I wanted to stay simple in my explanation, but things are probably more complicated. And just to first, when you are in apnea, if you are quiet and you just decide to perform an apnea, your oxygen consumption will remain the same. You are not making an effort. It's totally different if you need to, if you are underwater and try to. And in this case, when performing your apnea, you will decrease every minute 250 milliliter oxygen, okay? And if you have 1 liter oxygen in your lungs, because it's possible taking a deep breath, you can imagine that you will have 4 minutes before. But the reality, of course,
it's not the case.
I know it's more complicated than that. The oxygen level will, of course, decrease if you stay in apnea, and at a certain moment, your brain will decide to ask you to breathe again, and it's the stock of your oxygen will be all over your body, and when this level goes down at a certain moment, you will have to, and it's more complicated, just the oxygen consumption of 250 milliliters per minute.
Okay, thank you.
There aren't any new questions, but could you maybe quickly summarize the different symptoms that will be observed for the different severities of asthma attacks? For mild, moderate, and severe asthma attacks, what are the differences?
The symptoms. A mild asthma attack is characterized by shortness of breath, discomfort. People cannot do their everyday life. They must rest, and they feel short. They feel nervous, uncomfortable, nervous, and of course they breathe more rapidly. They are tachypneic. That's the beginning of the asthma attack. And if it lasts too long, before starting a treatment or I don't know what, then, because this first step, it's a problem of lower oxygen level. And the second step is when you become tired, exhausted. Then your level of CO2 will increase. And then you become exhausted, too calm, and less nervous, and less conscious. And in this case, your level of CO2 is increasing, and that's the worst situation. And as caregivers, we must prevent that beginning attack reaches this second and serious step. And if we give medication at the beginning of an attack, it should prevent the worsening of this.
Then maybe we can talk about precisions on ventilation when breathing like someone with emphysema. What happens to a healthy person's ventilation when they breathe that way, and what happens to the ventilation of a real patient with emphysema? I know we already discussed this on the forum, but maybe anyone else.
If I understand your question, what?
I know you answered this already. If we try to breathe like that, then we exhale more CO2.
Yes.
So
exactly. We exhale more CO2. We become, we are doing like hyperventilation. We exhale too much CO2, which means that our level of CO2 in your body will decrease. Your brain does not like that. And your brain will ask you to make this level going higher. How? You will need to find a balance between exhalation and inhalation again. So you will certainly start making a big inspiration, a big inhale, to take the time to for the time between inspiration and expiration become more balanced, and then your level of CO2 will increase again to find a normal level again. But you can, it's impossible to stay longer than, I would say, 1 minute breathing like an emphysema patient if you are in good health.
But for a real patient, they would be hypoventilating.
Yes, that's right. For a real, yes, you have to make the difference between an exercise for us and the real patient. It will not increase his expiratory time for a question of CO2. He will do it for a question of allowing his lungs to exhale as much air as possible. And it takes longer for him to just to exhale 1 liter of volume. And if he does not take this time, this longer time to exhale, his level of CO2 will be much higher than it is in reality. And even doing that, he has a quite higher level of CO2 than normal because of his lungs disease.
Mm-hmm. Thanks.
So maybe I would suggest to do you consider there would be other questions? Otherwise, we can.
There aren't any new questions.
No.
I think we've talked about the major things that come up in the forum.
Okay. Then maybe I would finish this session with just a few words about this MOOC in general, about the future of this MOOC, and to thank you, all of you, for your participation, especially in the forum, because it was a living MOOC, Living Forum. Thanks to you, of course, asking your questions, and of course, thanks to you for answering them, answering to every post, every message, even the welcome message of every person, and you're coming from everywhere over the world. I would like to thank you for that, to thank the audience for this MOOC. This MOOC remains open until Sunday evening. If you want to perform your last final exam, you have the time to answer and peer review the questions until Sunday. The forum remain open until Sunday, and from next Monday to the future, you always have the possibility to follow the videos, to answer to the evaluation question. The only things which will change is that the forum, discussion forum, will be closed. Otherwise, there will be certainly next year a new session with new videos, and you will be welcome to participate in the next session. Thank you again. Thank you all of you. It was a pleasure to work with you, certainly. And so, goodbye.